Drug Therapy in Pregnant People by Olivia Dishner. There are 5 pregnancy risk categories that I'm going to discuss. Category A. Risk to the fetus in first trimester has not been demonstrated in well-controlled studies in pregnant women. Category B. Animal reproduction studies have not demonstrated risk to the fetus and there aren't well-controlled studies in pregnant women. Category C. Animal reproduction studies haven't demonstrated risk to the fetus and there are no well-controlled studies in pregnant women. Potential benefits may outweigh potential risk in use of drugs in pregnant women. Category D. Evidence of risk to the fetus has been demonstrated. The benefits may outweigh risk in pregnant women if the drug is needed in a life-threatening situation and other, safer drugs cannot be used or are ineffective. Category X. Studies in animals or humans have demonstrated fetal abnormalities or evidence of fetal risk and the risk outweighs the benefit. The drug is contraindicated in women who are pregnant or in those who may become pregnant. Next are pharmacokinetic changes that we see in pregnancy. After a drug is absorbed into the bloodstream, especially a water-soluble drug, it is distributed more than in the non-pregnant state. This may require drug dose increase, and this is because of the increased plasma volume. Drugs, especially fat-soluble, are distributed more widely. Drugs distributed to fatty tissues stay in the body longer because they are slowly released from storage sites into the bloodstream. This is because of an increased weight. Increased excretion of drugs by the kidneys, especially those excreted primarily unchanged in the urine. This is because during most of pregnancy, increased renal blood flow and glomerular filtration rates are secondary to increased cardiac output. A decreased capacity for drug binding leaves more free drug available for therapeutic and adverse effects on the mother and placental transfer to the fetus. A given dose of a drug may produce greater effects than it would in the non-pregnant state, and this is because of decreased serum albumin. A decreased renal flow may result in delayed excretion and prolonged effects of renally excreted drugs. This is because in late pregnancy, renal blood flow may decrease when the woman assumes a supine position. An increased metabolism and clearance of many drugs may result because of increased hormones induced by drug metabolizing enzymes in the liver. Drug effects on the fetus. Medications may be administered to the mother to treat the fetus. Drug effects are determined by the amount and type of drug, duration of exposure, and level of fetal growth and development. Drug effects on the mother will be the same for the fetus. Maternal medications taken on regular schedule result in fetal blood containing 50% to 100% of drug amount in maternal blood. Brain development is continuous throughout pregnancy and after birth. Effects on the brain can occur with medications taken throughout pregnancy. Major concerns include abnormal embryonic or fetal development and fetotoxicity, which is harmful drugs like alcohol, morphine, cocaine, salicylates, coumarin, anticoagulants, sedatives, tetracyclines, thiazides, tobacco smoke, and large amounts of vitamin K. Pregnancy symptom management, so risk versus benefits, should be determined before administration of drugs. Non-pharmacological methods should always be tried first. Treatment may be required for anemias. Folic acid and iron supplements may be given. GERD, non-pharmacological methods such as eating small meals, no food before bed, no caffeine, and sitting in an upright position should be tried first. Next, antacids or H2 receptor blockers can be used. Constipation, non-pharmacological methods include increasing exercise, drink more fluids, and eat high-fiber foods. Gestational diabetes. Insulin can be administered. It does not cross the blood-brain barrier. Nausea and vomiting. The drug most chosen is ondansetron. Pregnancy-induced hypertension. Magnesium sulfate, hydralazine, and labetalol may be administered. Patient teaching. So a patient should be taught to avoid drugs when possible, take folic acid supplements of 400 or 600 milligrams per day. Herbal supplements should be used with caution. Effects are unknown. Alcohol, caffeine, smoking, and illicit drugs are all contraindicated. The patient should take measures to prevent the need for drug therapy by having adequate nutrition, exercise, and sleep.